Let's discuss about Meniere's disease. Any disease can be discussed under the following headings. First is introduction, second is classification, third is etiopathogenesis, fourth is morphology, fifth is clinical features, sixth is diagnosis and prognosis, seventh is treatment, and eighth one can be considered to be complications. Let's start with the first one, that is the introduction part of it. We'll study about the definition of Meniere's disease. Meniere's disease is an inner ear pathology. It is going to involve inner ear where there is distension of the endolymphatic system. There is distension of the endolymphatic system is going to get distended, as a result of which the endolymphatic sac and all the places where the endolymph is present is going to get distended. Coming to the etiology of this Meniere's disease. First, we'll consider about the age, then sex, and the laterality. Age, generally, it occurs in old age people, and it is more common in males and is usually unilateral. Now, let's talk about the causes. Any cause can be usually categorized into these nine groups. First is genetic cause, or it can be geographical, or it can be physical cause, or anything which is related to autoimmunity or simply called as immune system. I represents the infection or inflammation. D represents diseases like metabolic disease, bleeding disorders, all that. And H represents the hormones, and I I is going to represent invasion. Invasion means cancer. So it involves I is going to represent cancers and surgeries, and last one D is going to represent diet and drugs. In this Meniere's disease, we can find that due to physical factors like stress, due to increased stress, there will be sympathetic overactivity is going to take place. That in turn is going to cause vascular ischemia, that is responsible for Meniere's disease. Second is due to immune system, like autoimmune causes can be present, or it can be due to allergy also. And the third one is viral infection can also sometimes cause Meniere's disease. And fourth one is hormonal. For example, in case of hypothyroidism also we can see Meniere's disease, but this is a very rare cause where only it represents 3% cases of Meniere's disease. And the last is about the sodium and water retention. This can also lead to Meniere's disease. And remember that it can also be this vascular ischemia can result in what? This can result in decreased absorption from the endolymphatic sac, that in turn can cause Meniere's disease. Now let's discuss about the very important aspect. Before going to that, let me just show you this diagram also, which is going to tell you about the etiology. The etiology can be due to defective absorption of sac, it can be due to allergy, it can be due to autoimmune, or it can be viral cause, it can be due to stress, or it can be due to sodium and water retention, and even endocrinal. Let's talk about the pathogenesis of this disease. Pathogenesis. So, what is going to happen is there is, and as a result of the endolymphatic system getting distended, there is fluid is going to get filled more and more in the scala media, and that in turn is going to be pressing over the Reisner's membrane, causing the scala tympani to get extremely reduced. And also the saccule size also goes on increasing, and this is going to press upon the stapes foot plate, and also it is going to create an outpoaching into the semicircular canal. Now let's talk about the clinical features of this disease. Going to the clinical features, Meniere's disease can be having four important, or also called as the cardinal features of Meniere's disease are: the first that is going to occur is vertigo, then second is SNHL, which is nothing but sensory neural hearing loss, and then the third is going to be the tinnitus, and fourth is sensation of fullness in the ear. Let's talk a little bit in detail. So, let's talk about the vertigo. Vertigo is going to be episodic in nature. It is going to occur suddenly without any warning sign, and it can be followed by vomiting also. The vertigo can be to and fro motion or up and down type of movements can be seen. Coming to SNHL, SNHL is nothing but sensory neural hearing loss is going to occur. Here it can be there can be presence of what is called as diplocusis. What do you mean by diplocusis is that in one ear the frequency seems to be okay, the frequency of the sound is going to seem okay, but in other it won't be like that. And there is one more thing called as the Tullio phenomenon as well as the recruitment phenomenon. So as you can see over here, the Tullio phenomenon is nothing but when there is loud sounds are going to bombard on the ear, there will be vertigo seen in that person. This is because first itself, I have told you that is the saccule is already distended and is going to rest on the foot plate. So that in turn, since saccule is resting on the foot plate, therefore just smaller vibrations of the foot plate can lead to larger stimulation of the saccule, since saccule is responsible for the linear acceleration. Therefore this is going to cause vertigo in that person. Okay, and let's talk about recruitment phenomenon. Recruitment phenomenon means that the person the ear which does not hear low intensity sounds, and the ear which does not hear low intensity sound begins to hear greater intensity sounds as loud or even louder than the normal hearing ear. That is what is called as recruitment phenomenon. And then the third one is about the tinnitus. Tinnitus is going to be a low pitched type of tinnitus with a hissing sound will be seen. And fourth is the sense of fullness or sense of pressure inside the ear. Let's talk about the diagnosis and prognosis. In this, the first is diagnosis. On otoscopy, it is the ear is going to appear normal. There will be nystagmus in the person, so the nystagmus test, that is vestibular test, can be performed for that. And tuning fork test, if you do, it will be indicating all those signs which are going to show positive for SNHN. And then we can also do pure tone audiometry. This diagram is going to show you about the pure tone audiometry here. If you can see here, there is and the this is called the pure tone audiogram of ear, and here this is called the electrocochleography. Here you can see that the SP, that is the summating potential, and the AP, which is the action potential ratio, is going to get increased in case of Meniere's disease. That is, there is going to be a rising curve in case of Meniere's disease, and speech discrimination score is going to be 55 to 85%. And you can also do caloric test, which is going to be positive. Glycerol test also is going to be positive, which is nothing but is going to indicate that there is nystagmus is present in the person. There are some special tests you can note here. That is, first is called as the CC. CC is nothing but short incremental sensitivity index, which is going to be greater than 70%. Tone decay test is going to be less than 20%, and recruitment phenomenon, as already told, is going to be positive. Now let's discuss about the treatment of this disease. Meniere's disease. Meniere's disease has any disease can be treated by three ways. First is general line of management, and second is medical line of management, and the third is surgical line of management. Let's study about the general line of management, which is the when the person is going to have mild Meniere's disease, we will be suggesting about the general line of management. In this, we are going to reassure the patient, and second thing is we have to make the person to change his lifestyle. That is, first is diet. In diet, smoking and caffeine should be avoided, and salt and excess of water should be decreased. And then exercise should be increased and stress should be decreased, and there should be adequate bed rest should be taken by the person. Coming to the medical line of management, in case there is a sudden acute attack in that person, we can give vestibular sedatives can be given intramuscularly or intravenously. Alternatively, we can also give some sedatives like diazepam, dimenhydrinate, or promethazine. Or you can also give what is called as the histamine drips can also be given, and even carbogen inhalation can be given, which is 95% oxygen and 5% carbon dioxide. In case of chronic vestibulitis, in case of chronic Meniere's disease, vasodilators, hormones, like in case if the cause is due to the hypothyroidism, you can give hormone replacement therapy can be given, and even diuretics can also be given. Now, talking about the surgical line of management in case of Meniere's disease, first thing is decompression and of the endolymphatic sac can be done. Second is endolymphatic shunt operation can be done. Third is sacculotomy, that is making an incision in the saccule. Otomy means an incision, so making an incision in the saccule is called as sacculotomy, and this is also called as the fix operation. And the last is intermittent low pressure pulse therapy, also called as Meniere's therapy. So, one more last thing to be remembered is what is called as the Lermoyes syndrome. Lermoyes syndrome is nothing but Meniere's disease in reverse, wherein first there is hearing loss, then vertigo, then finally hearing recovery is going to take place. In case of, if you can see here, in Meniere's disease, first there is vertigo is going to occur, then hearing loss is going to occur. But in case of Lermoyes syndrome, there is first hearing loss that is going to occur, then finally vertigo is going to be seen. That's why this is also called as Meniere's disease in reverse. Okay, and just to summarize at the end, just to summarize, if you just want to remember 3 points about Meniere's disease, it's basically an endolymphatic distension, and its four cardinal features are vertigo, SNHL, tinnitus, and earfulness. And the treatment is for changing the lifestyle.